As long as I can breathe and I'm still alive, I'm gonna talk to somebody about prostate cancer. It's the easiest cancer to get rid of, as long as you catch it early. My name is Herschel Chalk. I am a 29-year, two-time prostate cancer survivor. I've worked for 24 years doing free prostate screenings and trying to help men to understand the necessity of getting a prostate exam.
Prostate cancer is the most common cancer affecting men. If each of us as men are lucky enough to live to our 70s or 80s, there's over a 50% chance that we'll have prostate cancer in our body. The sooner we can know about it, the sooner we can do things in a way that will minimize the negative outcomes of this. It's important that we be figuring out if someone has it and if someone has an aggressive form of it.
We should start screening for prostate cancer in patients that are older than 45 in presence of risk factors such as strong family history or African American background.
In African American and Black communities, we have tried to get people to realize that annual screening, talking to their primary care provider is very valuable because cancers seem to be more aggressive in those communities.
We have work to do to figure this out. This is something that needs to be done across the country, and it needs to be done both on a national level with research, but it also needs to be done on a local level to understand what are the unique features about the region I live in.
We have a partnership with the 513 bus in Hamilton County. We attend their events with them. We sometimes will bring prostate cancer screenings if that's what that community needs, and we connect them with resources. Our goal is that they don't just walk away with materials or freebies off of a table, but they actually have a conversation with us that's meaningful, that leads them to have action after leaving our table.
I've heard men get tested, they've got it, they tell their wife, we're gonna go home and pray, we're not gonna tell anybody. And they're ashamed, but it's not your fault. You didn't do anything to get it, it just comes.
I think one of the really exciting things that's happening, and I want men to understand, is we're getting to the point where an elevated PSA, perhaps it means there's a little bit of cancer in the body. It doesn't necessarily mean you're going to die from cancer. This test, which is very easy, quick to get, might alert us to it before clinical symptoms would manifest.
PSA is prostate-specific antigen. It has numbers attached to it, and it can tell whether or not there may be prostate cancer there. If the numbers come up and it's above 4, sometimes the doctor may want you to do a biopsy. The biopsy is going to determine whether or not you have prostate cancer.
Those type of biopsies are called fusion biopsies, and this is something that sets us apart in the tri-state Cincinnati area.
University of Cincinnati Cancer Center has a plethora of research, both in the laboratory as well as in the community, and by offering research, we can offer the newest and best, where you can't see that in other places that don't have the research portfolios that we have.
Other ways of innovation that we offer here at the University of Cincinnati Cancer Center are the latest treatment options that one patient with prostate cancer might look for. We offer either robotic surgery or radiation therapy. We work closely with our radiation therapy colleagues to identify who are the best candidates for each treatment.
This is a field that is poised to benefit from the decades of research, from the decades of work that scientists around the globe have invested in.
We're an academic hospital, and one of our missions is to improve the research and the outcomes of our patients. We do that by conducting research studies, conducting clinical trials, and philanthropy can help us in opening those trials.
We need donations to be able to support some of our outreach events. Those donations can directly pay for the materials required in screening because we offer those screens for free. So we don't have the funds to do that unless we have philanthropy.
Herschel walking around talking to people about this, about his experience, that is the ultimate means of helping. Herschel's wonderful, and I can tell Herschel's helped a lot of people.
Herschel is a great advocate. He has been advocating for prostate cancer for so many years. And so having him here is a wonderful presence because he does tend to send people to the 513 bus and to our events.
My mission was to be the mouthpiece, educate men about it, talk about it, because life is important. Your life is important to someone.